Hi everyone, so in this video we'll be discussing the key disorders across various systems, specifically the endocrine, reproductive, bone, renal, digestive, neurological, and cardiovascular. We'll focus on definitions, key signs, and easy mnemonics to help you remember these conditions and also help you with your final. Okay, so again, with the patho final, it'll be the module 4, module 5, module 6, and module 7. So let's get started with the endocrine. So endocrine and reproductive system. So with the endocrine and reproductive system, there are some of these particularly that end up affecting the development and hormonal regulation. So the first concept that we need to remember is that in delayed puberty in females, there's absence of sex characteristics by the age of 13. So think of those teen. So 12, it wouldn't count, right? Because it's 12. 13 is whenever you finally start seeing those teen, right? Those teen numbers. So a mnemonic for that would be 13 is too late for puberty scenes, or the scene of puberty. Delayed menarche. So menarche, remember, think of your March. So that's whenever you're starting your March, menstruation March. So there's an absence of menstruation by the age of 16. So 16 is there, and there's no cycle seen. No cycle has started. Polycystic ovarian system, so a syndrome. So PCOS, think of PCOS. So the is AAH, so androgen excess, anovulation, and hyperinsulinemia. So you're going to be thinking about your patient, making sure there's that increased insulin production, so bone and joint disorders. So these conditions impact the mobility and the structural health. Okay, so the bone infection or the sequestration, this is essentially bone necrosis due to increased pressure and vascular obstruction. So you see this within those 7 days. Okay, so one of the I guess the definition for that. So infection is pretty much leading to that bone death, right? So the isolated death in bone. Now we have osteoporosis. So that remember that suffix osteo, that is bone. So that bone, it's going to be thinning that trabecular bone matrix. So this ends up porous. So osteobone, porous, poor bones, so leading to porous bones. So think of old thin bones need calcium to own their throne. So as you can see, think of also whenever you have pores in your skin or in your face, so porous. We have osteoarthritis. So in contrast, osteoarthritis stems from joints overuse. Okay, so wear and tear over a lifetime. So OA, think of that overuse. So this would be a distinction between osteoporosis and osteoarthritis. Okay, so make sure you know the differences between those two. Next, we have gout. So this is caused by uric acid buildup. Okay, so this presents in intense joint pain. So that pain is from that inflammation. Okay, so make sure you remember that, and the mnemonic for that would be gout. So gout is G, so that great pain onset in uric trouble. So remember, there's that buildup of that uric acid, so urine trouble, right? Okay. Now, osteopenia. So osteo, we still have that root word osteo, or that prefix osteobone. So penia, so we're lacking. So penia would be that your bone matrix is thinning. So there's early thinning of that trabecular matrix, okay? So anything penia is lacking, right? Or decrease or deficient. So for instance, right here, leukopenia. So penia is decreased or that deficient, erythrio or leuko, all that would be the blood cells, right? Right, so let's turn our attention to the renal and urinary disorders. Okay, so we have acute glomerulitis, okay? Acute glomerulitis. So in acute glomerulitis is a key sign of periorbital edema. So orbital, so remember, think of back in AMP2, orbital edema is swelling. So you're going to see that swelling on those eyes, around the eyes, okay? So for this, think of for this particular question that you might see on your final is what are signs and symptoms from acute glomerulitis? So you'll see that periorbital edema, okay, that swelling in the eyes. Okay. Now, functional incontinence. Functional, so think of your functioning, your body functions, right? So this would be that incontinence would be the inability to move without assistance and leading to incontinence. So you have a patient that comes in and they're saying that every time they move from sitting position or laying down position to sitting position or standing up, they have incontinence. So this would be classified as functional incontinence, okay? Then we have stress incontinence. Stress incontinence, in contrast, stress incontinence happens when urine leaks during any actions such as coughing, laughing, sneezing. So your patient comes in and they're saying that they're trying to do a squat and they just have incontinence. Or that stress of coughing, whenever they cough and it makes that urine press on, and then they have that incontinence, okay? Now, finally, renal caniculi or kidney stones, they're associated with the increase of calcium loss from the bone. So all that calcium, so think of stones that equals calcium clones, okay? So all that calcium ends up leaving and they create these stones. And you can see here, they're pretty much look like stones, okay? Right. Now let's discuss digestive disorders. So these conditions impact nutrient absorbing and gastrointestinal function, okay? So with acute pancreatitis, patients experience severe abdominal pain. So patients going to be having a lot of abdominal pain. They're going to come in, but that abdominal pain ends up radiating to the back, okay? You're going to see that your patient's also going to be having a fever and they're going to have low blood pressure. So these are signs and symptoms of acute pancreatitis. So think back, we did some of these questions in class. So you have a patient, they come into the hospital and they're having a lot of that pain. It's radiating to the back. They have that fever, hypotension. Hypo is low, so low pressure. So hypotension. And so what would that be? That would be acute pancreatitis, okay? Right. So for hiatal hernia, so common symptoms include that heartburn. So thinking back, I know I mentioned this in class. Whenever I had a hiatal hernia, I had a lot of that acid buildup going back, and I would have those heartburns. Okay, had difficulty swallowing, and what was that first line of treatment was the acid reducing medication. So having the acid reducing medication, so there won't be that much buildup, okay? There is an example of that hiatal hernia. It just shifts up from the stomach and moves up, okay? In celiac disease, gluten sensitivity leads to malabsorption, okay? So those are malabsorption. Celiac disease, always just think malabsorption. And fatty stools, okay? So this is known as steatoria, okay? So with steatoria, they'll have fat, pale, and smelly stools, okay? So that is commonly associated with that celiac disease. All right, colodocholithiasis. So this is stones in the common bile duct, okay? So what I want you to remember is that so common stones duct, okay? So what ends up happening here, it ends up we'll be having obstructive symptoms, okay? So this is caused by those. And it is also inflammation. Okay, neurological disorders. So we see how pretty much it disrupts the nervous system in these neurological disorders, and also ends up affecting those movements and cognition. So with Cushing's disease, so think of Cushing's, we talked about this in class, think about a cushion or a seat, right? So your patient is going to have that round face, the hirsutism, a lot of bruising. So you're going to see a bruising and abnormal striae. So think of Cush, so C, so that chubby cheeks, U for unusual bruising, S for striae, and for hirsutism, okay? Now, Parkinson's disease. For Parkinson's, symptoms include rigidity, slowed movement, and the classic pill rolling tremor, okay? So you'll see your patient will be shaking a lot. So think of PARC. So PARC for P for pill rolling, akinesia, rigidity, and kinetics lost, okay? Now we have MS. MS, multiple sclerosis, occurs due to immune cells attacking that myelin sheath. So MS, multiple sclerosis, think of myelin sheath, okay? Now we have TIAs, transcystic ischemic attack. So these are temporary decrease in blood flow to the brain. Okay, so this is called often called a mini stroke. So these events are short term and typically resolve within a few minutes to an hour, but they still carry the risk of a full-blown stroke down the road. Okay, so some of these symptoms may mimic those that are of a stroke, and sudden weakness, numbness, but they typically don't last that long. Okay, so temporary interruptions of TIA, think of temporary interruptions of arteries. So this mnemonic, it reminds us that TIAs are temporary blockages in the arteries, right? So it's essential to recognize these signs quickly and prevent, in order to prevent that full stroke that we don't want to see in our patients. Now let's talk about the cardiovascular system and cardiovascular disorders. We have here, the first one would be, oh, here we are. Hemorrhagic stroke risk factors. Okay, so this occurs when a blood vessel in the brain, it bursts, okay? So this leads to blood within the brain, as you can see here in this image. The key risk factors include uncontrollable hypertension and a brain aneurysm. So patients, they will be experiencing severe headaches, a lot of nausea, vomiting, and if they're not treated promptly, this bleeding can cause brain damage, right? So the mnemonics to think about here would be stroke equals stress plus broken vessels. So this mnemonic helps you remember that stress, particularly chronic stress, leads to uncontrolled blood pressure, and then can lead to ruptured blood vessels, which essentially ends up causing that stroke, okay? So always consider hypertension as a major contributing factor when evaluating these strokes, okay? Now, increase intracranial pressure. So when there is increased intracranial pressure in the brain, it causes various symptoms such as, again, as what we see, the headaches and nausea, but also altered mental status. So tachycardia, which is increased heart rate, is not a symptom of these conditions. So remember, tachycardia is not a symptom of these conditions. So it's pretty much the brain's way of trying to compensate for that pressure, but the body really can't keep up, okay? So think of that mnemonic of pressure pops, but not the pulse, okay? So this helps us remind us that when pressure builds up inside the skull, it only affects the brain, not necessarily the heart rate or the rest of the body in this sense, okay? Now let's move on to some general symptoms and diagnostics. So diabetes. So diabetes insipidus, this is a condition that is characterized by the deficiency of antidiuretic hormone, or ADH. So this hormone helps the kidneys regulate fluid balance without that ADH, we end up experiencing extreme thirst. Okay, so think of diabetes insipidus. So inside you want to sip, inside you're really, really thirsty, right? So you're insipidus, that frequent need of being thirsty and needing to drink water would end up leading to frequent urination. So this can lead to dehydration, right? Because you're urinating so often. So this mnemonic would be dehydration from insufficient ADH. So it makes us easily remember that the lack of that ADH leads to dehydration. So the D for deficiency, D for dehydration, okay? Now moving on to our kidney. So acute glomerulitis, so this is a condition that often follows strep throat infection. So if you have a patient that comes in and they are having, some of that periorbital edema, so swelling around the eyes, dark urine, but then you check their chart and it says that they have had strep throat. So we know that checking this history would indicate most likely that they have that acute glomerulitis. So acute, remember, acute, you're only cute for a short period of time, right? So it's only that small instance, okay? All right, now we have mumps in males. So another condition, or we can call it arthritis. So itis, remember this inflammation, right? So another condition, so linked to a viral infection would be arthritis. So this inflammation is within the testicles. It's often caused by mumps virus. So mumps virus can be very painful, swelling in the testicles, right? So any pain, swelling, irritation, pain, right? So this, in some cases, may end up leading to fertility issues if it's not managed properly. So think of mumps equals males in miserable testicles. So this mnemonic gives you an easy way to remember the key symptoms of that swollen, of that pain testicles in males that have mumps, okay? Right, so finally, we have nephrotic syndrome. So this is a kidney disorder that is characterized by proteinuria. So, or the presence of excess protein in the urine, right? So when a person recovers, the protein levels, they should normalize, right? And so this would indicate that that there is healing within the kidney's function, okay? So no protein means normal progress. So this is, so we have excess loss, proteinuria. Okay, right. And then over here we have some, I just have some questions just for review. So we have a patient, Maria. She's 54 years old. She reports of increased thirst, frequent urination, fatigue, gradual onset of symptoms. She lives a sedentary lifestyle and has medical history of renal neuropathy and cardiovascular disease. Based on the presentation, what is the most likely diagnosis? Okay, so thinking of this, it can't be hypothyroidism, right? So that's just going to be one of those answer choices that we will eliminate. Gestational diabetes. So what did we talk about gestational diabetes in class? This is whenever mama is pregnant, right? So you don't, this isn't anything to do with that. It's a 50-year-old woman. What are our keywords here? So she does have increased thirst, she has frequent urination, and she lives that sedentary lifestyle. So we know, and has history of renal neuropathy and cardiovascular disease. So we know this can't be gestational diabetes because it doesn't indicate that she's pregnant. Can't be hyperthyroidism, and it can't be type 2 diabetes because, again, she lives that sedentary lifestyle, and that was one of our key words for classifying for that type 2 diabetes. Okay, so yes, type 2 diabetes mellitus. Okay, during a routine checkup, a nurse notices that James, a 72-year-old man, has a curvature in his upper spine. So this is commonly referred as hunchback. So what condition is most likely the cause of this? So osteoporosis, right? So he's 72 years old. He has that curvature, hunchback. Just think of osteoporosis, okay? All right, we have one more that we will do. This is another thing just to note for the test. Make sure you know those normal ranges. So for temperature, for blood pressure, your respiration rate, make sure all of those, I will be posting that on the announcements as well for you. But here's the question. So a nurse is assessing Kyle, a 48-year-old man with type 2 diabetes mellitus, okay? So he presents with a fasting blood glucose of 100 milliliters per deciliter. His temperature is 101, his pulse is 88, respirations are 16, and the blood pressure is 122/84. Which finding would be most concerning? So let's go ahead and start. We have the blood pressure. So our normal blood pressure is 120/80. So that is totally normal, right? And then we have our respiration, 16. So it's within that threshold of 20, right? So we're okay. The pulse our pulse should be around 60 to 100, and he's at 88, so he's okay. But then what do we see here? Our temperature. Temperature is 101. And he has diabetes. So this is a really, really high temperature for him. So our abnormal temperature would be one of those things that we will be most concerned about in this patient. Okay. I will be posting more example questions on my announcements on the quizzes. There, if you guys have any questions, please don't hesitate to reach out. Thank you.